Dr. J welcoming you to the second part of this video on fetal development in the womb, and in this one we are going to see what's happening to your baby in the second trimester of pregnancy. So in the first one we spoke about the 4, 8 and 12 weeks. Now let's start with the 16th week of your pregnancy. At the 16th week your baby is about 4.5 inches long. The eyes have started to appear very nice, very well developed and in position, and the ears also have moved to more or less the permanent on the normal position. The baby at this point, believe you me, has started to breathe, like breathing underwater, because the baby is submerged in the amniotic fluid. So the little bit of fluid goes in and goes out, and like the inhalation and exhalation, the baby is showing the breathing movements. Your baby's heart at this age, in this tiny little baby, pumps about 6 gallons of blood every day. And the heart rate is double your heart rate. So the heart is beating very rapidly and pumping about 6 gallons of blood into the system per day. The skin has started to have deposits of fat underneath. The finger and the toes are completely separated now. They are very, very visible, and fine lines in the palms of the baby's hands have started to appear. Now at 16 weeks, at this age, when your baby is about 4.5 inches long inside your womb, if you took a peek inside, you will see a lot of things going on. You will see the baby sucking the thumb. So the sucking reflex is there, the swallowing reflex is there, and the blinking reflex is there. So your baby blinks the eyes. And at this age, the brain cells are multiplying at the rate of 250,000 cells per minute. Now that is an enormous number of cells. So you can imagine at what rate the brain of your child is growing at this age. All the other organs are growing at the normal rate. The heart, the lungs, the liver, the kidney, the spleen, all the other abdominal organs are growing at the normal rate. And the kidneys at this point have started to produce some urine now. So the first functions of the kidney in terms of producing urine is now being established and observed at this age. Okay, so what do you think your baby's size is at 20 weeks of age in your womb? You're probably right. At 20 weeks, your baby is about 8 to 10 inches long and about 1 pound in weight. The eyebrows and the eyelashes are now forming very well, and other fetal hair, the hair on the top of the head and the hair on the other parts of the body is also beginning to develop. And the first sweat glands in your baby's skin are now forming at this age. And the nerve cells for all the vital senses like vision, taste, touch, hearing and smell is being laid down in specialized areas in the brain. And at this point, at 20 weeks, your baby is growing well, and then the muscles and the bones are growing stronger, and now you can start to feel the kicking movements of the baby in your womb. So sudden jerky movement, the kicking movements in the womb are now starting now. Your baby can also hear now, and that's evident from the baby getting startled by sudden loud noises or sharp sounds. The baby gets startled. So that's an evidence that the baby is beginning to hear now. And from now on, whatever the baby hears, what kind of language the baby is exposed to, what kind of music the baby is exposed to, what kind of sounds the baby is exposed to, the baby will derive a lot of comfort listening to the same sounds after the baby is born. Another major development at this stage of the baby's life in the womb is that if your baby is a girl, the uterus has formed and the ovaries have formed. And the ovaries have about 6 million eggs already in them over there. And if it's a boy, the testes have now started to descend into the scrotal area, into the scrotum. So that's what's going on at 20 weeks of age in your baby. Now at 24 weeks of gestation or 24 weeks of your baby's life in the womb, the baby is about 12 to 14 inches long and roughly about 1.5 to 2 pounds in weight. And this is the end of the second trimester of pregnancy, and at this point the baby is officially considered viable, which means that if the baby were to be born now, there are increasing chances of survival of the baby. At this point, the brain cells are forming at the rate of 500,000 cells per minute with 1.8 million connections or synapses between the cells going on right in there every second. At this time, the lungs are branching out very well, the branches are being formed, and the lungs are also producing an important substance called surfactant, which helps in keeping the lung inflated and functional. At this time, the baby can be observed opening and closing the eyelids. The baby also has hiccups. And if you do an ultrasound, or when your doctor does an ultrasound, you look at the ultrasound, you will often see the baby sucking on the thumb. Taste buds at this time are very well developed in a small baby. So be careful, whatever you drink, the baby can taste that. And it's often seen in ultrasound studies and so on, how the babies react to different flavors of drinks. So if you drank something bitter, the baby would show his or her displeasure, and vice versa. So that's what's happened until the end of the second trimester of pregnancy. In the next video, I'm going to talk to you about what goes on in the last trimester of pregnancy. Thank you for watching this one, and I'll see you in the next video soon.